Hi, Dr. Man again, mini health talk to get you healthy again. Today we're going to talk about overreactive gag reflex. Overreactive gag reflex is a normal reflection for us to protect ourselves from harmful things swirling into our system. But overreactive gag reflex causes a lot of health issues. So what are the causes of overreactive gag reflex? Number one, touch, any kind of mild touch, which are not supposed to cause gags, but it does. Taste, sight, smell, sound. Some of patients have acid reflux, or some of multiple sclerosis patients. And also stress and anxieties can also aggravate it. And intense physical activities, sometimes you run too much, you're so exhausted, if you touch a sore area, you can puke. And strong and disagreeable odors, or some of the people when they smell some incense or too strong, which is not agree with what they like to smell, and cause gags too. Sensitivity or allergic to certain liquids or food. So, what is the pathology of overreactive gag reflex? Simple. Overreactive nice cranial nerve or glossopharyngeal nerve. So this nerve is too excited. In Chinese medicine, the pathology is rebellious stomach and lung qi. Yes. So diagnosis is simple. On the back throat or oral pharynx muscle resist to swollen or be touched by things that are not harmful to the individuals. So that's a diagnosis, very easy. So acupuncture treatment, when we talk about acupuncture treatment, please don't jump into the point selection first. As a healer, we need to focus on the causes and pathology of the overreactive gag reflex. Since the cause of overreactive gag reflex are mainly overreactive glossopharyngeal nerve, we desensitize the gag reflex by, number one, using a soft toothbrush, very soft toothbrush. Try to touch the tongue a little bit, inch by inch, closer to where you can, you're gonna get the gag reflex, and then keep doing it. And if you gag, that means you mean too far. For about 15 seconds, brush the area. Repeat the process once a day until your tongue no longer feel the urge to gag again. That area becomes desensitized. Then move brush slightly further back, quarter to half inch, and repeat the process. Move the brush further and further until you come to your tongue's farthest visual points, which doesn't cause gag reflex. So this is a very effective way to train your nice cranial nerve not to overreactive. Next one. So acupuncture point selection are mainly to desensitize the glossopharyngeal nerve and sinking down the rebellious stomach qi and the lung qi in Chinese medicine. So local point ring 24. That's a very good one point. I also use outside Jin and outside Yu Ye. So Jin Yu Ye, you have to poke the tongue, make the bleeding there. That's what usually cause slurred speech. We treat the slurred speech. But for me, I like to poke from outside here to poke the Jin Yu Ye point to desensitize nice cranial nerves. So I usually connect them with tense units. So do some electric stimulation to desensitize them. Distal points, large intestine 4, pericardium 6. This large intestine 3 and pericardium 6. These 2 points, when you have gag reflex, you can also do the acupressure too. And lung 7 and ring 12. Ring 12, usually when somebody who has gag reflex at ring 12, I usually deeply insertion until I know my needles reach the stomach. But if you are not experienced with that, I don't want you to do that yet. But for for experienced practitioner, you should be able to do that. This Rental deep insertion can also treat acid reflux too. So acid reflux is kind of overactive sympathetic nerve. Stomach 36 with tension, you stim the stomach 36 and stimulate the outside 津津鱼液. That helps a lot. For ear, you can put the pads on stomach, lung, and 扁桃 in the earlobe area. Those three ear points should decrease gag reflex too. So for the Chinese herbal therapy principle are the same as acupuncture, which is to sink down the stomach and the lung qi. 平胃散、止宿散、银桥散、葛根前莲汤. Take 3 teaspoons 3 times a day, dissolve with hot water, and shake well before use. So let me explain why I use it. So 平胃散 sink down the stomach qi. So 平胃散 usually used for somebody who has nausea or vomitings. And 止宿散 sink down the lung qi is used for stopping the coughing, but it works great together with 平胃散 to stop the gag reflex. 银桥散 is decrease the chance of URI, upper respiratory infection. So when you use 银桥散, you clear the upper respiratory so they don't have inflammations, and then you will decrease the sensitivity. 葛根前莲汤 decrease the chance of bacterial infection in the stomach. So when your stomachs calm down, the gag reflex will slow down too. The other thing, if you feel like any kind of liver involvement, I want you to use 柴胡疏肝汤, 疏肝汤 into the formula too. As far as you follow the treatment plan, 80% of the patients should recover about 80% in a month. The other 20% of recovery usually takes about anywhere from 2 to 6 months, depending how well the patient do the soft toothbrush desensitized training. So those are very important part of the treatment plan too. I wanted to thank you again to join me today to learn about overreactive gag reflex. We'll see you next time. If you like our program, please thumb up. If you like to learn more about my clinical medical experiences, you can subscribe to many health talk channels. Thank you again. We'll see you next time.